everyone, and welcome to our podcast. I'm your host, Dr. Harshita, and it's a privilege to introduce our distinguished guest today, Dr. Priyanshu Mathur, a renowned pediatric, rare, and metabolic genetic disease consultant based in Jaipur, Rajasthan, India. Dr. Mathur's contributions to the field have been recognized with an honorary doctorate in genetics by the International Internship University in 2021. He is a keen researcher with a more than 50 publications in national and international journals. He is a reviewer of 5 journals, including 2 international journals, JIMD and BMC Genomics. He's also co-author of the book Rare Disease in Pediatrics and Atlas on Pediatric Rare Disorders and has written chapters in 5 books. Also, he has a particular interest in pediatric rare disorders, neuromuscular disorders, metabolic genetic disorders, and newer therapies in genetic disorders. Today, he joins us to share insights on preventive genetic disorders. Welcome, Dr. Mathur. It's a pleasure to have you here with us today.
Thank you very much, Harshita, for inviting me today here.
Yeah, thank you, Doctor. So, Doctor, before we begin, could you share your clinical journey and experience so far?
So, my journey in the field of medical started in 2000. So, I joined as a MBBS student from VIMS Vijayanagar Institute of Medical Sciences, Ballari. So, that was in Karnataka. So, I completed my 5.5 years training in Ballari. After that, I moved to Delhi. So, I prepared for MD exams. After that, I joined my MD in pediatrics in 2007 at Dr. SN Medical College, Jodhpur. So I completed MD in 2010. After that, I joined a few fellowships for short duration in intensive care and pediatric cardiology. Then I came to Jaipur. I came back to Jaipur. I joined SMS Medical College. Then in 2014, I developed my interest in genetic disorders. I entered into the field of pediatric rare diseases. Since more than 80% of pediatric rare diseases are basically genetic disorders, so they need a very high expertise and a big team to deal with. So I was working with SMS Medical College, and the hospital in which I am working is the name is Jekyll Hospital. So it's one of the largest hospital in northern part of the India, and we are having huge patient load. So after joining this institute, I got an opportunity to move to US. In 2018, I moved to US in MD University. I got a designation of visiting assistant professor. I worked under the Department of Human Genetics there and learned a lot in the field of inherited metabolic disorders and genetic disorders during my stay at Emory University School of Medicine, Atlanta, Georgia, USA. I returned back in 2019 and then again started working in same hospital, same field. Since then we are growing with number of patients, with the skills, and we are equipped with more and more treatment. So we are now able to treat many patients previously which were considered as a non-treatable disorder. So this was my journey.
Yes, thank you, Dr. Priyanshu, for sharing your journey and experience. Now, let's delve into our discussion on how to prevent genetic disorders. So, Dr. Priyanshu, individuals are often concerned about their genetic risks, especially when it comes to family planning. So, could you share key steps individuals can take to understand these risks and make informed decision about family planning?
That's an amazing question. So, Harshita, I want to tell you that the risk of genetic disorders are tremendously increased in previous few years because of lot of reasons. And the most one of the very important reason is that diagnosis. We are now equipped with the diagnostic facilities, so we are able to diagnose more and more number of patients. So, according to National Policy on Rare Diseases 2021, it is described that 6 to 8% of total population is suffering from one or other rare disorders, and out of these rare disorders, 80% are genetic. So in other terms, we can say that there's 7,000 to 8,000 disorders which are part of a rare disorder, which are considered as a rare disorder. But among these, around 80%, that are 6,000 to 7,000, are basically genetic disorders. So to prevent genetic disorders nowadays, because we are encountering a lot of patients with genetic diseases, we are able to diagnose. So public also, they also seeing lot of genetic disease patients in their surroundings. So lot of patients are coming to us. They want to prevent genetic disorders in their family or in their close relatives, or in their second degree or third degree relatives. So first and foremost point is the correct diagnosis. So if we are having correct diagnosis of any patient any patient suffering from genetic disorders, like example, if in a family there had a history of spinal muscular atrophy or Duchenne muscular dystrophy or any other genetic disorder, we should first ensure that the diagnosis was correct or not. Okay, because before 2010 there was very little genetic diagnostic facilities were available across the country. So we were not able to confirm the diagnosis. The most of diagnoses which were made were depending upon the clinical features. But after 2010 there are a lot of genetic testing laboratories available across the country. We are now correctly diagnose these patients, that is known as a molecular diagnosis. So if we want to prevent any disease in the same family or in a first degree or second degree relative, we, after identifying that diagnosis, we can opt for prenatal diagnosis or preconceptional diagnosis. So there's a difference between prenatal diagnosis and preconceptional diagnosis. When we are able to diagnose genetic disorder in the embryo state or fetal state, so the first 9 months of the 9 months of the pregnancy, if we are able to diagnose genetic disorder in that period, that is known as a prenatal diagnosis. And second is preconceptional diagnosis. Few families, those who are having history of genetic disorders in family, when they are planning their marriage or when they are planning to go for conception to bear the child, they want to know the possibility of recurrence risk in their progeny, their kids. So for that we can opt for preconceptional diagnosis. For that we can send couple carrier screening for genetic disorder and the SMA and DMD MLPA test, and we can know about the genetic disorders if they are carrying. So to simplify it, I want to simplify it. To simplify it, I just want to bring a point to the notice of the listeners of this podcast, that we are having different category of disorders such as autosomal dominant disorders, autosomal recessive disorder, X-linked disorders, and mitochondrial disorders. So the majority of disorders are autosomal recessive. Among that category, autosomal recessive disorders, both the parents can be carrier. So they don't manifest the disease, but they carries the disease. So when such parents marry, there are 25% risk of having defective child or child with disease. So we can easily identify these patients by preconceptional testing or prenatal testing, and we can prevent. They can opt for a termination of pregnancy, and they can again bear the baby.
Thank you, Dr. Mathur, for shedding light on the key steps individuals can take to understand their genetic risks and make informed decisions about family planning. And now, in your opinion, Dr. Priyanshu, how effective do you find current genetic counseling services in raising awareness and providing practical guidance for individuals and couples?
So I will say, I would like to say that we are growing in this area. So genetic counselors nowadays, we are in India, there are a lot of genetic counseling services are available, and the understanding towards the genetic disorders is gradually growing. So now, when I started my practice, these services were not available across the country. They were limited to the few centers only, and there were only few qualified persons were available in the country. But now, each and every state, or I will say almost 3 to 4 centers are available across all the states, in each state, and the genetic counseling services are available, and it's quite effective. People now understand what is genetics, what are genetic disorders, what are the recurrences risk, and how we can prevent the genetic disorders in subsequent pregnancy. And parents usually consult us if they are having any family member suffering from any genetic disorder. They consult us, they are reaching to us, they are now aware that these disorders can be prevented by the timely interventions.
And Dr. Pranshu, looking at the broader picture from a public health perspective, what initiatives or educational programs do you think could significantly reduce the incidence of genetic disorder?
That's again a great question. So first and foremost is definitely awareness, and awareness among the medical student. That is also important because they are the future of this country. So the medical curriculum should include the part of genetics in chapter in the medical courses. That is very important. Second important is newborn screening. That is very important. So the newborn screening means that few disorders which are now treatable, they can be diagnosed by screening test in the early neonatal life. So when the newborn is born, between second day to seventh day, we can send the blood spot testing. We can take 3 drops of blood and we can send that blood to the laboratory, and we can screen that whether they are risk of having any disorders, any genetic disorders. And if the risk is positive, if it is showing the positive test, we can go for a confirmatory testing. And if we confirms that diagnosis, we can start treatment early and we can prevent disability and death in these particular kids. So that is a very important strategy. And as per WHO also, that in countries where the infant mortality rate is less than 50, the genetic services should be available, and it should be newborn screening should be a norm in these countries. Even India started working on it. As per as the latest available information, at least 10 states are doing newborn screening in smaller or a limited way. They are implementing this newborn screening policy in their state. We are still waiting for a national policy for newborn screening across the country. I hope if a national policy is formed for newborn screening, that can help all these states and they can adopt the national policy, national guidelines, and that will be easier for the state to implement it if there will be written recommendations. So that is one point. Second is genetic services. So genetic testing services should be available across the country. Genetic testing facilities should be available at least all the centers across the country, and that's a need of an hour. In my view, almost 10% of the population, they will be or they need genetic testing at one or other point of time, including pharmacogenomic services.
Now, appreciate your thoughts, Dr. Priyanshu, on the potential public health initiatives that could significantly reduce the incidence of genetic disorders. And of course, collective effort is needed and is indeed important in addressing many challenges. So, now moving ahead, given the rapid advances in genetic technologies, Dr. Mathur, what ethical considerations should guide the development and implementation of genetic disorder prevention strategies?
So, first and foremost is the genetic testings. Ordering a genetic test is very easy, but we should restrict it because uh, there are lots of lab, those who are doing genetic testing, and most of these are the private labs. So they are approaching the doctor and they are promoting doctors to send the genetic test. But the problem is, like neurologist, cardiologist, gastroenterologist, endocrinologist, hematologist, hemato-oncologist, they have now started prescribing these tests directly. But in my view, there should be an interface with the geneticist. They should consult with the geneticist before sending the genetic testing. The reason behind this, because the interpretation of genetic testing required a lot of efforts. So it's not a simple blood test in which machine gives direct report. Okay, so machine generates lot of data, and in second part we need bioinformatics tool to interpret the report. And to have a very good bioinformatics information, we need to have a very good summary. We need to write the HPO terminology, that is a human phenotype ontology terminologies. So if we are not writing the terminology correctly, sometimes these reports are misleading and they are giving the wrong diagnoses. So I want to make aware people about this point, that whenever they want to send any genetic test, they need to consult with the geneticist prior to sending that sample, prior to sending the test. And one more important point, that genetic testing is not a single one test. There are different type of tests. Genetic testing is a broad umbrella. Under that, microarray is one of a specific test. Karyotyping is another test. Sequencing is another test. Sequencing is of different type. That is a whole exome sequencing, whole genome sequencing, or Sanger sequencing. So I just want to give the example. There are different type of genetic tests. Some patients suffer from a particular disorder which can have a different type of genetic defect, like nucleotide repeat disorders. So they need a different test. But most of these companies are offering to other specialists apart from geneticists a single test, that is whole exome sequencing. But that is not correct, because sometimes we can diagnose few disorder with a test which is cheaper than this test. So that is important. And second important point, we should not order the genetic test in children less than 18 years of age. If we are not having any strong index of suspicion because of some clinical pointers towards the genetic etiology. Because it is seen that around 70% of the genetic disorders can be seen in children less than 18 years of age, and 30% of genetic disorders can happen in more than 18 years older people. Okay, and if we are sending genetic tests without any strong clinical pointer, and we get a test positive for a diagnosis which is a late onset disease, the symptoms appears in a later life. So we are troubling them, we are giving them a psychological burden in their mind, and they are losing the pleasure of today. Okay, pleasure of present. So that is a very strong important point that we should know before ordering any genetic test.
Yes, that was great insight, Dr. Priyanshu. And for healthcare professionals listening in, what advice would you give to healthcare professionals in terms of integrating discussions about genetic risk factors into their routine patient care?
Yes. So for healthcare personnel, I want to tell there are two different type of disorders. One is multifactorial disorders, and second is genetic disorders. So in multifactorial disorders also there can be genetic predisposition, like in diabetes. So diabetes is not truly a genetic disorder, it's a multifactorial disorder, but the genetic predisposition can be there. Okay, like hypertension. So we can see many patients present in a single family all are suffering with hypertension. So that is basically genetic predisposition, but it is not a genetic disorder. So the healthcare personnel, they should understand this difference. And the genetic disorders, we have different categories like single gene disorders, chromosomal disorders, and deletion duplications. So they should develop this understanding also. They should consult with geneticists, because everybody can't understand everything. So because there are different streams, that somebody is studying ophthalmology, somebody is studying otorhinolaryngology, somebody is gynecologist. So they are expert in their field, but they can't be expert in another specialty. It's not easy to become a specialist in another field. I want to give an example. So just like I am a geneticist, but one physician sent a test for a suspected genetic disorders. He received the report, but he was not able to interpret the report. Okay, so then they sent the patient to me. I interpreted the report, and then I confirmed the diagnosis. Okay, so I think they should keep in touch with a geneticist before ordering any test. Second important point, that after getting genetic test, usually we get the defective gene. Okay, so now because lots of companies across the globe, they are working on developing newer therapies for different genetic disorders. So the newer therapies are basically based on the pathophysiological mechanism of that genetic defect. For example, I got a patient. That patient had a defect with the calcium channel, and that defect leads to the upregulation of the calcium channel. So, based on the pathophysiology, I was clearly able to make out that if I will give a calcium channel blocker to that patient may have improvement in his symptoms. So I started calcium channel blocker, and that patient showed significant improvement. And this was not described in any treatment protocol previously, because that was such a rare disorder that was described only in 5 patients till that time. Okay, so my first point is because there are a lot of newer therapies which are based on the pathophysiological mechanism. There is a term, the term name is drug repurposing. So, drug repurposing means we have few medications which are already available and approved in market, but they are approved and marketed for a particular disease or particular indication. But when we learned the pathophysiological mechanism behind the genetic disorders, sometimes we came across few cases that can have a positive impact with already available medication, but that medication was approved for a different indication. Okay, so we tried these medications in these patients, and we could able to clearly make out significant difference in the life of these patients. So it is not always that we should look for a permanent cure. We can make their quality of life better even with the pathophysiological mechanism based approach and precision medicine, patient to patient therapies. So that message I want to give, and the final conclusion to the which I want to give to the healthcare personnels, that you should not lose the hope. Okay, so for few disorder I want to give example. When I diagnosed the patient, that time there was no therapy available for that particular defect, but after 3 months when I again searched the literature, so then I came to know that now the drug is available in different part of world. So many genetic disorders, those were considered as a non-treatable, they are becoming treatable day by day. And I hope that 2024 and 25 are going to be great years, because lots and lots of newer drugs are going to hit the global and Indian market. So many disorders will be now treatable. I'm hoping for that.
Okay, doctor. And now, looking at a collaborative approach, how can policymakers collaborate with healthcare providers and communities to create comprehensive and accessible programs for genetic disorder prevention?
Right. So policymakers, they need to collaborate with doctors definitely, because we are the one those who are seeing the patient in day-to-day practice. We know which disorders are increasing and which disorders are decreasing, because policymakers, they make policy for next 5 to 10 years or 15 years. But few disorders, when I started my practice in 2010, the infectious diseases were very common. But over a period of time, I have seen that because of very good immunization practices across the country, the infectious diseases are decreasing nowadays. And newer viruses or newer bacteria are coming. We had seen the COVID pandemic. Similarly, the genetic disorders, hematological disorder, oncological disorders, rheumatological disorders, endocrine disorders, they are on rise. So the policymakers, they are using their funds in those disorders which are now controlled, but they are not able to focus on the disorders which are now increasing, because they can take a shape of a pandemic in future. So it's very prudent to interact with the healthcare personnels and policymakers with healthcare personnels, because that really has a positive impact on the policy making. I want to give an example also. So since 2018-19, we were seeing a lot of patients. They were not having any infection, but they had high grade fever. When we evaluated these patients, so we found that these patients are suffering from a disorder that is a autoinflammatory diseases. And this phenomena even increased after COVID pandemic also. So in autoinflammatory disease, these patients, their own immune system were attacking against their own body. So that are known as autoinflammatory syndromes, autoinflammatory diseases. So these disorders tremendously increased in my hospital, and similar phenomena was observed by other hospitals and other countries also. And then we realized the disease epidemiology is changing, and we need to focus on the what we are seeing now, and we need to go in depth into their manifestations. We should do the research, and we should diagnose more and more number of patients, and we should look for a newer therapies for these disorders. So my conclusion is, policymaker, it's very important to work in collaboration with the healthcare personnel and policymakers. Then only we can have a better policy, and we can decrease the suffering.
Yes, Dr. Priyanshu. Collaboration on this scale is essential for addressing the broader societal impact. And as we wrap this insightful discussion, could you share your key takeaways message for our listeners? What advice would you like them to carry with them after this enriching discussion?
Right. So first important message is कि a doctor should learn each and every day, because there are a lot of advancement across the globe, and we should be open to for a newer things. We should read daily, we should learn daily, we should upgrade our knowledge daily, we should attend regular conferences, and we should uh, read research articles. That is very, very important. Second message I want to give, that research and development is very, very important, because uh, we can see that the Western world, like US and Europe, they are discovering newer and newer drugs, and they are filing the patent, and we are purchasing all these drugs from the Western country. So we are wasting a lot of Indian currency in getting treatment from abroad or Western country. So the message I want to give, that we should have a scientific mind also. The physician means doctor, scientist matlab researcher. So the physician scientists are the best for development of the country and for the healthcare professionals and healthcare sector. So the purpose of the medical colleges is to have a physician scientist, so they can treat patient, and they can look for the changes in disease epidemiology. They should generate the data, they should look for a newer molecular target, they should help the industries in developing newer drugs, and then only we can treat more and more number of patient, and we can stop people migrating only to seek a better treatment in Western country. Because we have seen so many celebrities, they if they had a disease, they move to a different country, and they spend lot of amount there and getting treatment there. I want that our country should be self-sufficient, everything should be make in India. We should be able to develop newer and newer therapies in India.
Yes, Dr. Priyanshu, your key takeaway message resonates strongly. It's a call for awareness, collaboration, and proactive measures in addressing genetic disorders. So, thank you, Dr. Priyanshu. We truly appreciate your time and expertise in this enlightening discussion.
Thank you very much, Harshita, for inviting me on this platform.
Thank you, Doctor. And to our esteemed audience, we hope you found this podcast enlightening. If you have further questions or would like to explore more topics in the world of medicine, don't forget to connect with us on our MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with esteemed medical professionals, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. Until next time, stay informed, stay curious. Goodbye.